Hi, Dr. Phil.
Hi, hi.
We have
Hi,
doc-
good afternoon.
we have Dr. Mahinder as well. You can see our Kangen team, Dr. Mahinder.
Mahinda, good afternoon.
So Apple,
Good
after
afternoon, good afternoon, sir.
you can book
Nice to see you since
af-
long.
after Durian, you can book Apple Gardens there with him. We have
Okay.
Dr. Phil. We have Amita, specially for which we have kept what I told you. And there's one more Kangen distributor, Mr. Kamal Bist, who has got a same kidney issue with his brother. He may also join, and Dalbira. So just it's all basically kidney and Kangen water, and one to one they can ask, and we finish off maybe in
Okay.
30 minutes, whatever it is.
Yep.
Yeah.
So if you have some questions, ask me.
Yeah, Amita,
Should we start?
Amita, you can go ahead. Amita, go ahead.
Okay.
Yeah.
Uh, Dr. Phil, good afternoon, first of all.
Good afternoon.
Yes. My very first question is, like, I have talked to you before about the same thing that my husband hasn't. Last year we have a kidney transplant,
Okay.
right?
Okay.
So now I have a Kangen machine at my home. From yesterday, from yesterday I have started giving him 8.5 pH water. So I just want to get the details that it will it will have a side effects or something like that for the immunosuppression tablets he's taking.
Dr. Phil,
Okay.
can you hear?
Kangen water does not affect any medication that you may be drinking for any kidney patients. The consideration here, I know you are probably going to ask two things. One is whether there are any contraindication with your immunosuppressant drugs.
Yes.
And second is how much Kangen water can you drink per day?
Yes.
These are the two main questions. I have typed in that Catherine in Singapore had a kidney transplant, and she was drinking Kangen 9.5 daily between 4 liters and 5 liters.
Oh.
And she's feeling really good about it. If you want to talk to Catherine directly, you probably have to connect with Janet in Singapore, and she might be able to get Catherine online for you to get first hand. But she presented, she shared her testimonial with a big group of, I think, around 50 people at one time. And her consumption of 4 to 5 liters a day does not seem to give her any problems at all. So, because the transplant patient now has a fully functional kidney,
Right.
okay? So, consuming anything between 3 to 5 liters per day is not a problem.
Yeah.
How many kilograms is the patient? Is the person in concern? Unless you tell me his name, I have to keep saying that.
My husband's name is Prashant.
Prashant.
Yes.
Okay. So, how heavy is Prashant? How many kilos is he?
He is right now 82 kgs.
Okay. 82 kgs. You don't have to put in on 4 to 5 liters immediately. Okay. You can start him off on, let's say, what is he used to drinking water currently? What is his rate of consumption currently?
Before we used to have RO water.
Oh, so how much of hydration is he doing per day?
He can drink around 5 liters.
Okay.
No issues.
So
yeah.
All you have to do is swap your 5 liters from RO water to Kangen water. If you want to have a slower transition, you can start him off on Kangen 8.5.
Yes, I have. Last night I have started him for 8.5, But with taking at the time of taking medicines, because they have to take the medicines on the similar intervals on the same time.
Okay.
So at that time, I'm giving him pH 7.
Okay, that's fine. I mean, please bear in mind that the recommendation for not taking Kangen 9.5 and medication at the same time is a precaution. It does
Okay.
not mean that all drugs are contraindicated. It is not. It
Okay.
is a precaution because most people who are drinking Kangen water are not familiar with which drugs may be affected and which drugs may not be. So, as a general precaution, we said, okay, avoid Kangen 9.5 as a general precaution. The drugs that you are taking may not be affected at all. So, to just keep it simple for everyone, just avoid Kangen 9.5, drink Kangen 7.0 during the time of taking the medication.
Medicines. Yeah.
Yes, and about an hour later, you can already change over to Kangen 8.5 or 9 or 9.5 that you're consuming. Not a problem.
Not a problem.
Okay. Now,
Yeah.
as far as immunosuppressants are concerned, you will find that Kangen water, as you already probably know, Amita, is or hydration in your body generally is 70% of your body.
Yes.
You need to look into his other body requirements. And body requirements, I refer to things like nutrition and so on and forth. Yeah.
Yep.
So when it comes to nutrition, dealing with one of the relevant areas is having to deal with your immune system.
Yep.
Because what immunosuppressant drugs do is to suppress your immune system so that it doesn't reject the kidneys. However, that also means that you are artificially suppressing your immune function.
Yes.
So you do not want an hyperactive immune system. What you want is a more balanced immune system.
Yeah.
And to have a more balanced immune system, you want to look into the nutritional requirements for immune moderation or modulation.
Okay.
Not immune stimulators. So stay away from immune stimulators. You'll be fine. But pay attention to immune moderators. The immune moderators are things like vitamin D3, things like NAC, ALA. These are all immune modulators. Okay, a certain amount of vitamin C is good as an immune modulator as well.
Yes.
And of course, you will notice that a lot of these things have an antioxidant nature. So Kangen water with high levels of antioxidant provides for a good dose of antioxidants, but you need to look into the immunomodulatory components, which is like D3, ALA, NAC, not immune stimulators like echinacea and all those things. Okay.
Okay.
I have a question. One more question.
Yes.
Prashant have a potassium level high in his blood test electrolytes. He is having still that problem. The potassium level is coming bit higher.
Okay.
So he's not able to eat fruits or fruit juices or something like that.
Yes. If he has only just had, when did he have his surgery?
In February 2019.
February 2019. Okay.
1.5
Then-
year ago.
Okay. What are his other blood markers? How is inflammation in the body? HSCRP, for example.
I'm not clear about that. Means-
Okay, I want to see how his body is responding to the operation 6 months later or a year later.
Once Once after 3 months of the transplant, he got the rejection.
Okay.
After that, we have a plasma treatment,
Uh-huh.
and then after it is responding.
Okay.
Till now, the reports are coming normal. His hemoglobin and whatever I can understand from the reports, his creatine level is around 1.1 to 1.2, something like that. It fluctuates between this. And
Okay.
according to the nephrologist, they says he will remain in between this ratio. The only thing which is
Okay.
fluctuating is potassium. His coming potassium is 5.5, 5.3 level instead of 4 to 4.5. And he's
Okay.
putting weight as well.
Uh, he's putting on weight as well. You need to watch his dietary requirements. What are his dietary requirements currently?
Actually, they says nothing important. They can eat whatever they want to eat, but the side effect of that steroid he is taking in the morning tablet, he feels more hungry.
So he is still on steroids even after a year
Yes.
after the operation.
Yes, the ratio is 0.5 mm and 0.10 mm. One day he has to take 0.5 mm, and second day he has to take 0.10 mm.
I would recommend that if possible, that he do a more comprehensive blood work to see where his body is heading. Do not wait for symptoms to come before you check certain blood markers. Do a comprehensive screening of all important markers. I can give you a list if you like of the important markers.
Please.
Okay. You see, the nephrologist may deem certain markers to be unimportant, but he is only concerned about his kidneys. You got to understand that the kidneys is connected to all the organs in the body. So we're going to look into the other parts of the body as well and make sure that the other parts of the body are working fine.
Okay.
So the challenge with dealing with specialists, medical specialists, is that they're only concerned about the little corner.
Oh,
so,
yes.
If you try to do more, they'll say that is not relevant or important, but that is not important to them. But you got to understand that Prashant needs all the parts to work together.
True.
Prashant needs every organ in his body to be working fine, not just the kidneys.
Yes.
Okay. So what I can do is give you a series of blood markers as my recommendation for you to do, and then see whether all his body organs are working fine. And then from there, you can determine as to potassium levels. Is he eating potassium-rich foods, for example, like bananas?
No, he's not eating any fruit. The fruits are restricted because due to the potassium only. So
not all fruits are high in potassium. There are other fruits that you can take, but banana
he's not eating.
Okay.
He's not eating because he's afraid like potassium will increase, and that's why he's not eating any one fruit. But we are eating vegetables, so vegetables are also consuming potassium. They have potassium in vegetables as well. So, but up to certain level, I have to give him vegetables and rice and dal and whatever the normal diet we have over here.
What about the oil that he used for that he is consuming in his food? What kind of oil is being used?
We are using sunflower refined oil.
You need to get rid of that sunflower oil and change it to something more sensible. And
such as?
Coconut oil is one of the better ones.
Coconut oil?
Yes. Rice bran is another oil you can use. And avocado oil is also a good oil, but it's rather expensive. So I would say that, if he enjoys the smell of coconut and everything, then coconut oil is fine. If you like more neutral approach, then rice bran is basically without any particular flavor. So you use
Flavors.
that for,
Rice
for
bran.
cooking.
Yeah. Yep.
And you need to look into his balanced diet in terms of his fat consumption. If you
True.
always taking starch, that's not going to help him. He needs
Yes.
fat soluble nutrition.
Yes.
So look into don't neglect his lipid consumption.
Okay.
You can if you are having dal, you can put coconut oil into the dal. If he doesn't mind the taste.
I'll try that one because I'm sure he will not like the taste of coconut oil. He says, yeah.
Okay. Okay. If he doesn't like coconut oil, then you have to look at other ways. You may need a seed grinder. Get a electric seed grinder. It should be quite easy to get. And then you take things like flaxseed. You grind it fresh every time.
Okay.
You do not grind this morning for tonight. It
Okay.
becomes rancid and it's bad. So it must be ground fresh
Okay.
to be consumed. Okay, that's one way to do it. Do not buy flaxseed oil because it gets rancid when it's half a bottle.
Oh.
I know that big bottles usually come at a better bargain, but it's very bad for health.
Dr. Phil, how is mustard oil?
Mustard oil is not the best oil for cooking either, but I know it's very popular in India.
Yeah.
It's very common. Every kitchen has mustard oil. I would look into his lipid nutrition, for the sake of his kidneys health. Coconut oil is one of the best if he can enjoy that as part of his lifestyle. If he doesn't like coconut oil, then you have to look into other options.
I'll try rice bran.
Okay. Amita, you have any children?
Yes, I have one boy.
Okay. You know that coconut oil is literally the closest to mother's milk. So therefore, it is the best replacement for lipid nutrition.
Okay.
But if you really cannot stand coconut oil, then you have to look at other options. But that is the best.
Okay. Okay. I'll try once and then what he says. Let's see.
Yes. And do you live in Mumbai or Delhi or which city in US?
No, I live in Gujarat.
Oh, Gujarat. Okay.
She is beside Dr. Falguni.
Okay.
She's a downline of Dr. Falguni as well.
Yeah.
Okay. So you need to pay attention into lipid nutrition because your kidney cells needs lipid nutrition to build, to repair.
Okay.
Okay.
Yeah.
If you keep taking rice and dal and all these, which are literally lipid free, you end up lack of all the fat soluble vitamins like A, D, E, and K. You probably cannot avoid taking some supplementation as well, to ensure that his body it has all the nutrients that he needs. You cannot consider him like everyone else because he is in a more fragile state that needs to be handled. And over time, he can become more resilient and less sensitive and less fragile.
Okay.
Okay. And how long would that take? Nobody knows because it depends on how his body recuperates.
Yes.
Okay.
Yep.
One of the most common issues with Kangen hydration is that people are too lazy to go to the toilet. They think that going to the toilet is a problem.
No. Right.
Yeah, Amita, you
Yeah,
already
yes.
know that not
Yes.
being able to go to toilet is a bigger problem.
Yes, right.
So the message here is that everybody should be happy, should be joyous that they are able to go to toilet to urinate every hour. It's a good
Yes.
sign. Okay.
Yep.
So any other questions that you have that I can help you with?
No, that's the only I was a little bit scared that should I start with this one or not, because he's on the medication and he was telling me that should I
So
start or
you,
not. He was confused drinking before this Kangen water, and the
okay.
potassium level was high, so he was telling that it will not increase my potassium if I'm drinking this water. I said to
Okay.
him no.
Do you have a pre-filter for your Kangen machine?
Sorry.
Do you have a pre-filter for your Kangen machine?
Pre-filter,
Is there-
yes, I have. Yeah, I have.
What kind of pre-filter do you use?
I have a RO pre-filter. I don't know what kind of it is.
Dr. Phil,
Means-
Dr.
That's
Phil, there's a problem in Gujarat. They have the TDS is very high, so they're using an
Okay.
RO to get it to a certain level, less than 300. Then they're putting that water into the machine.
Yeah,
this is fine.
Yeah.
my
That
base
is fine.
water, my base water TDS is around always coming from 1200 to 2000.
Okay. Then using your RO as a pre-filter is perfectly
Yes.
fine. Okay.
So I should start
Any-
with 8.5 and up to
Yes,
till what
start with
stage?
Start with 8.5. The best thing is not to overload hydration by drinking a small glass every hour.
Okay. So
Don't try to drink 1 liter every 3 hours.
no, he drinks water on a proper way because he cares for
Proper
the
way.
kidneys.
Very good.
Yeah.
Okay, very
After
very
every 1 or 2 hours, he drink 1 or 1.5 or 2 glasses.
Okay. So the Kangen hydration should also reduce some of the acid stress on his kidney, so that there'll be his kidney should feel much better.
Oh, that's the only thing I want to know, that if he drinks this water, his kidney will start diluting potassium, which is coming in his blood.
Hmm.
It will
So-
start clearing the potassium.
You need to flush out minerals. The way to flush out minerals is to do more hydration, 1 glass every hour.
Okay.
Yeah, accepted.
Not 1 liter every 3 hours, but 1 glass every
1 glass
hour.
every hour.
But you are not there.
Yeah.
Yeah.
Okay.
Yeah, I got it.
All right.
तेरा
Which
नाम तो
machine
है
did
नहीं,
you
पता नहीं,
did you
दलबेरा
invest
है
in?
बस. You are not there.
SG501.
AC5 is a very good machine.
Okay.
Yes.
Yeah.
Okay.
Okay. Very good. I'm here to assist you if you have more questions another time.
Okay.
Yeah, sure, definitely.
Okay.
Dr. Phil, we have also another Kangen distributor downline of Dr. Mahinder and Dr. Vijay, Mr. Kamal. Kamal, you can switch on your video. Switch on your video, Kamal.
I see another phone number and an Oppo. But I have
Yes,
no
yes,
idea
yes,
who
yes.
they are.
Yes, that is Mr. Kamal Bist and his sister. Can you please switch on your videos, please?
Okay.
Okay, Kamal. Kamal Bist is a downline of Vijay Chauhan. He's got a machine and he wants to buy another K8. Okay,
Okay.
go ahead. Go ahead. Go ahead.
Actually, I want to purchase from my sister because
Okay.
cousin sister. So his brother is facing the same problem of kidney problem. And all. That
Okay.
details. I forgot to date some 10.2. Some numbers are there that when both the kidneys are failed. Both the kidneys are not
Okay.
working. So he go for dialysis in a week twice. He go for dialysis and all. So I have
Okay,
spoken
what
to
is-
Amita.
Dr. Phil, I'll just
What
give
is
you a
it?
brief. His creatine levels are 10.2. And I remember I had sent that report to you. That's the report of his brother.
Okay. Because he's doing dialysis twice a week, it tells me that his glomerular flow rate or GFR is at a low figure, but not total kidney failure yet.
Yes.
So I would recommend that you take the same approach as what I have suggested to Amita, is that the patient concerned drinks one glass of Kangen water every hour, okay? And it will start flushing out toxins. You see, the kidneys are there to filter out toxins and filter out impurities. And it gets clogged up if there's insufficient hydration. You need to flush out these toxins, okay? Keep drinking Kangen to flush out the toxins, like you flush out kidney stones, the same thing. And for kidney stones, you saw the video of the doctor who flushed out his own kidney stones in 8 months. So don't expect to see results in 1-2 weeks. It takes many months. But if you are persistent enough and continue to do over many months, you will definitely see results. The most common pitfall to not getting results is not drinking sufficient Kangen 9.5. People come and tell me, I didn't get the results I was expecting. And then you ask them how much are they drinking, they say, I drink 2 glasses per day.
Dr. Phil, what I had recommended him is you go for the most powerful machine, which is K8, which has more antioxidants, which will give him better results faster.
Yes, you get more antioxidant per glass of water than any other machine in the world. Now, the second biggest pitfall is people tell me they don't get results is, I say, how much water do you, Kangen 9.5 you drink? And they say they drink so many glasses. And I say, which machine do you have? They say, I don't have a machine. I get water from my friend. And the water is 1 week old. The 1 week old water doesn't do anything for you.
Yeah.
Don't waste your time. So these are the 2 areas that you must remember. Drinking Kangen water must be fresh from the machine. If it cannot be fresh from the machine, it should at least be freshly filled within the same day. Not from yesterday, not from the day 2 days ago, not from a week ago. Okay? If you can't finish your bottle of water from last night, throw it away and get a fresh one. Do not be too concerned about throwing away half a bottle of good water. Okay? Get fresh Kangen water whenever you can. So, even if you go out for half a day and you bring your Kangen water bottle and you are not able to finish it, when you come back to the house, fill up with fresh ones. Don't bother with the one from half a day ago. It is still good, but it is even better with fresh water. Don't you think so?
Yes.
Yeah. So I know that you guys may have heard of some of the benefits of the 4th property of Kangen water, which is hydrogen. Hydrogen is only there when it's fresh.
Active
Kangen water is
yes.
not fresh, it's no more hydrogen. Hydrogen is a gas. It escapes very quickly. So you should drink it straight. Okay? You all know how to test for hydrogen, right? You just put a lighter on the flowing Kangen water and you see sparks. So, Mr. Kamal, this is what you need to do. Low kidney function, usually 99% is associated with insufficient hydration of the right kind of water. Drinking RO water does not give you cellular hydration. You need to drink Kangen 9.5. And you need to drink sufficiently and fresh. Okay.
Kamal,
Any other
anything else?
questions you
Anything
have?
else, Kamal? Otherwise, Dr. Phil is very busy. I requested him. He's got very short time now. So,
Yes.
anything else anyone
Is
has
the
to ask?
dialysis-
Anything else?
Is that Kangen water will reduce the dialysis duration? It will start reducing that duration later on after months and months and months.
Okay. Once after many months, you need to monitor this GFR figure or creatinine level. When creatinine level drops or GFR level increases, you'll find that the frequency of the dialysis can reduce as well.
Yes.
So monitor the creatinine or GFR figure as your guide. Because if he hits a kidney patient, what they always do is monitor his creatinine level. Once you have creatinine level, you can actually mathematically calculate GFR percentage.
Is it possible that kidneys presently in worse condition they can recover up to some level?
Kamal, just bear in mind that you can heal a sick horse, but you can't bring back a dead horse. So as long as GFR is not zero, there is a chance.
There is
If
chance.
GFR
Okay.
is zero, there's no chance.
Okay. There is no chance. Right. Okay.
How do you know if GFR is zero? GFR is zero if the patient no longer produces urine.
Okay. Right.
So as long as the patient produces urine, there is a certain amount of kidney function.
Okay.
So you don't need a special test to tell you whether the kidney is completely dead or is still functioning to some extent.
Right, doctor. Right.
Okay, Kamal, is that useful for you?
Thanks, doctor. Very much useful to me because that there are certain mindsets are there that is not clear.
Hmm. So if you find that the person drinks Kangen and is going to toilet more often to urinate, is a good sign. Not having to go to toilet is a bad sign. Okay?
Right.
Because when the kidney is completely dead, you no longer go to toilet. Very convenient. But not good thing. You need the inconvenience of going to toilet because it's a sign that your kidney is functioning.
Oh, thank you so much,
Okay,
Dr.
Kamal,
Phil.
does that
Thank you so
make
much.
sense to you, Kamal?
Thank you very much.
Okay, now the last words from Dr. Mohinder, if he has anything, and then we close the session. Dr. Mohinder, anything from your side?
Thanks a lot, Dr. Phil. It's quite knowledgeable
I think
words
Okay.
from his side, and it will be useful in routine practice also.
As I mentioned to Ajay some time back, that his whole team I committed to assist. For those who takes the initiative to invest in a Kangen machine with him, I will support them with these kind of questions to bring them further so that they can benefit more.
No, I told them, doctor, I'll be straightforward. I told them what I told Dr. Phil doesn't usually entertain others out of his team. Otherwise, he's charging $200 per hour.
Right.
Which is true, when I do visiting consults at Global Doctors Hospital in KL, they bill 100 US per hour.
Oh,
Yes.
anyway, thank you so much, Dr. Phil, and very helpful for the team. And I wish we have our teams joining and where your support is there throughout, anywhere in the world. Thank you so much, Dr. Phil.
Thank you.
Okay.
Thank you, Dr. Phil.
Thank you, doctor. Thank you so much.
Okay.
Bye,
Thank you very
doctors.
much.
Bye.
Bye.
Bye.